So good evening, everyone. We didn't come to stay here all night. We're just excited to formally introduce you to the Men's Health Equity Institute. I am Dr. Georgiana Logan, founder and executive director of the Men's Health Equity Institute, and I'm joined this evening by our board of directors, which you will hear from momentarily. I want to start off by saying thank you for your support for this very important and timely nonprofit. Men's Health Equity Institute is a 501c3 organization which serves men throughout the United States. Men's Health Equity Institute serves as a research and health promotion learning collaborative that promotes education, research, service, and policy initiatives that raise awareness about men's health and well-being. Men's Health Equity Institute works to address social determinants of health and political determinants of health that impact the lives of boys and men all around the US. When you hear us mention terms like social determinants of health, we're referring to the places in which individuals are born, learn, work, live, play, pray, and grow. These determinants often involve one education, employment status, socioeconomic status, their access to healthcare, neighborhoods in which they reside, and so forth. While the political determinants of health, which may be a new concept to some, it refers to those political systems and strategies that have historically and currently disadvantaged and serve as the root cause of many health inequities in society. These political determinants of health center around voting, government at all levels, and policy, which includes your laws and regulations that are enacted that may hinder or advance an individual in society. So our mission here at the Men's Health Equity Institute is to help reduce and eliminate disparities by addressing health inequity experienced by boys and men as a result of those social determinants of health and those political determinants of health. We do this work in partnership with community organizations, healthcare agencies, governments, agencies, and most importantly, the communities in which we serve. Men's Health Equity Institute works to improve the health and well-being of all boys and men, regardless of their race, national origin, age, disability, gender identity, religion or beliefs, their sexual orientation, veteran status, parental status, or other protected status. So a little bit about me. I am a professor and researcher with a background in health education, health promotion, and public health. And my research endeavors include health disparities, men's health, environmental justice, and fatherhood. So Men's Health Equity Institute for me provides a platform for highlighting and addressing men's health issues that often go unnoticed and neglected in some aspects. And as a result, men often have poor health outcomes than women, and men live on average 6 years less than women, which is almost a decade. So this work would not be possible without a team of experts who I'd like to introduce to you tonight. We'll start with the president of the Men's Health Equity Institute, Mrs. Jacinta Logan.
Hello, everyone. My name is Jacinta Logan, and I am the president of the Men's Health Equity Institute. The reason why men's health is important to me is when it comes to prevention and early detection, men's health often takes a backseat to women's health. That's why it is so important to address social determinants of health for men to help reduce their health disparities and to possibly help improve their health outcomes.
Very well said, Jacinta. Thank you. We're so excited to have you on this team. Next, you'll hear from Mr. Antoine Martin, who's our VP of Operations.
Hi, everybody. My name is Antoine Martin. As Dr. Logan said, I'm VP of Operations. So part of my duties are finding funding opportunities to support a lot of the programming and activities that we do here at the Institute. Why men's health matters to me, just to echo off what my colleague Jacinta said, that a lot of times men's health is put on the back seat, and I don't think it gets enough attention. And so as a man, I can think of, we tend to put off routine checkups and we tend to delay our care. And so all of that, can lead to, more serious developments and disease and illness and ailments. And just thinking about the COVID-19 pandemic, when we look at cases, men and women are practically equivalent, but we're seeing in terms of mortality and death that more men are dying from this than women. So that's why I think it's important that, we raise awareness in communities and look for ways to support communities in mobilizing resources around men's health.
Thank you, Mr. Martin, for that wonderful introduction. Next, we'll hear from Mrs. Deshauna Ballard, who serves as our VP of Communication and Curriculum Development.
Hello, everyone. My name is Deshauna Ballard, and as Dr. Logan mentioned, I'm the VP of Communication and Curriculum and Development. So that means that a lot of the messages that you see on social media, anytime we're really trying to get a public message out there, I'll be responsible for doing that. And also, we'll have things like workshops that kind of target topics that are very important to men's health, and I'll be responsible for developing the curriculum for that. So, why is men's health important to me? Men's health is important to me because men essentially are the foundations of our communities. Whether that means you have like a father, a grandfather, an uncle, a nephew, a cousin, or whatever, to protect their health means that you're protecting the foundation of the community. And I think that's why men's health should be talked about more, just to kind of encourage healthy behaviors within that particular population.
Thank you so much, Mrs. Ballard. I really like how you mentioned men being the foundation and the pillars of our community. And I think sometimes that often goes unrecognized or undervalued. And so thank you. We're really looking forward to your contributions to this organization, and really looking forward to seeing those social media messages that's highlighting and raising awareness about men's health. And then looking forward to these workshops that you're going to be helping to develop to really push these men health equity initiatives forward. We also have Dr. Kristen Allen Watts. You'll see her name on here, but she's currently in an area where she cannot speak with us right now. However, Dr. Kristen Allen Watts serves as our VP of Community Engagement. And so we talked about doing this work with community partners, government agencies, healthcare providers, and most importantly, the communities in which we live and we work in, right? And so Dr. Allen Watts is responsible for establishing and creating those partnerships with these organizations so we can go out into the community and really bring programs and solutions to communities to really advance men's health and tackle some of these health equities that we see within this population. And so we're so excited to have Dr. Kristen Allen Watts on our team, which you'll be hearing from next week when we talk about men's health, the state of men's health, and a candid conversation. And so we also have three other people who we have to acknowledge. We have three research assistants who really do a lot of the background work, sometimes that you just don't see when we're doing these social media posts or creating these workshops and programs. And so one of our research associates is Mrs. Mandy Harper, who's a Master's of Public Health graduate student. We have Mrs. Alyssa Milby, who's an undergraduate health science student. And then we also have Ben Anderson, who's an undergraduate health science student, and they all come from Marshall University. So we're really, really excited to have them on the team. So as we begin to wrap up, we want to thank you for coming out to meet with us. And we want to encourage you to please visit us at www.menshealthequityinstitute.org. It's where you can stay up to date on all of our programs, our events, anything that's happening with Men's Health Equity Institute. You can find it there. Another place that you can go, please visit us on our social media platforms, Facebook, Men's Health Equity Institute. Instagram, Men's Health Equity Institute. And then on Twitter, you can find us under Equity Men's. We also want to highlight a current scholarship opportunity that we have currently going on. We are providing 3 $500 scholarships for recent high school graduates or men currently enrolled in a 2-year or 4-year institution. So please visit us on those social media platforms, visit us on our website, and so you can find out how you can apply for one of these 3 scholarships to help advance your academic career. Thank you, thank you, thank you. This work is impossible without your support. We look forward to seeing you all next week on Facebook Live. We were having technical difficulties this evening, but we will figure it out. And we hope that you will join us next week when we talk about the state of men's health in the U.S., a candid conversation. Thank you so much. And we hope you have a wonderful, wonderful evening.